Now, in the world now today, we begin in China, where authorities in the Chinese city of Wuhan have launched an ambitious campaign to test all of its 11 million residents after a cluster of new cases raised fears of a second wave of infections. At least 2 of the city's main districts have delivered notices of the campaign on a door-to-door basis and sent out online questionnaires through community workers seeking information about tests people have had and if they belong to what are deemed high-risk groups. The Wuhan government earlier said the city had 53 laboratories to process tests and 211 locations where nucleic acid tests can be done. Wuhan was placed under a lockdown on 23rd January and was only lifted on 8 April. It reported 6 new cases over the weekend, the first infections since the curbs were removed. And world leaders insist any eventual COVID-19 vaccines and treatment should be made available to everyone free of charge. And South African President Cyril Ramaphosa and Pakistani Prime Minister Imran Khan were among more than 140 signatories of a letter saying any vaccine should not be patented, while the science should be shared between nations. The letter comes amid fury in France after pharmaceutical giant Sanofi said it would reserve first shipments of any COVID-19 vaccine for the United States. The company's chief executive, Paul Hodson, said the United States would get first dibs because its government was helping to fund the vaccine research. But according to African Union Chairperson Ramaphosa, nobody should be pushed to the back of the vaccine queue because of where they live or what they earn. And Global Affairs commentator Kunle Falowo joins me from Indianapolis to discuss this development. Good to have you join us, Kunle Falowo. Now, let me take this comment coming from the Director General of the NCDC here in Nigeria. And he says, I just want to quote him, that we must insist on equitable access to these vaccines when they are developed by engaging globally. As we look inwards, we must also look outwards. And now we're also seeing more than 140 leaders also calling for the same thing. Why is this important?
Thanks for having me. Well, it's very important because world over, this COVID-19 coronavirus is wreaking a lot of havoc to the economy, to world economy, and they're saying that the entire world might even go to a what's referred to as a recession. And this is big coming from world leaders, and we're saying that according to the National Institute of Allergies and Infectious Diseases and Control, they're saying that not only that you can contract the disease, also there's a new research that says that just by talking to somebody, if you're infected, you have a higher chance of infecting another person, and that's pretty huge. So at this time, we will need a collaborative effort by world leaders from the developing country to the advanced nations to come together and work collaboratively to ensure that every country gets a vaccine, just like polio, in every country from India to Pakistan to Nigeria, everywhere. So we should have just the same as the COVID-19.
All right, so there was a virtual COVID-19, global COVID-19 summit held by world leaders sometime during the week. And President Trump was obviously absent from that meeting. And that meeting was held to raise about $8 billion for the vaccine. And there are rising fears, this is raising fears that President Trump's lack of cooperation might lead to a global vaccine brawl. What do you make of that?
Well, yes, that's very disturbing, to be honest with you, because what the Trump administration is currently doing is they're collaborating directly with the pharmaceutical companies involved in making and testing this vaccination. And I must also say that this vaccination going on, like with the pharmaceutical companies, they're at different clinical trials and levels, and after that, with the results, and it's different. The WHO is saying there's about 100 of them currently going on, and it's in different categories of trials. Having said that, Johnson & Johnson, for instance, got huge millions of dollars directly funneled from the US government to this different pharmaceutical companies, like I said. And this is huge because the nationalist policy of President Trump and the US administration currently would not allow a collaborative or cooperation at any level or at any international. It will be very difficult for many countries, even advanced countries, to get their hands on it if, peradventure, some of these companies that the U.S. government has heavily invested on or in get their hands on the vaccine. They might eventually just give it to the U.S. government, which is not going to be very good for every other country.
So the U.S. is funding research in France, as we now know, and also Germany and some other places. If the U.S. doesn't get on board with other leaders, how optimistic are you that we'll get a vaccine anytime soon?
I think I lost you a little bit, but I still get your question. I'm still optimistic because humanity is at stake. There is a current hearing in the Senate, here in the U.S. Senate, and Vermont Senator Bernie Sanders has also called for a universal approach to collaborating and making sure that the vaccine, when eventually ready, is available to every country around the world, the respected senators and lawmakers in America, and I believe that some people will share the same ideology. But having said that, it's very possible that world leaders can still renegotiate with the Trump administration, and different policymakers will intervene, and for the good of everybody and for the greater good of all, they will eventually cede and will have more collaboration, but not now. Hopefully, when the vaccine becomes available.
Public Affairs Analyst Kunle Falowo, many thanks for sharing your thoughts with us.